Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones, and today we're joined by our expert guest, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the Patient Education Specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book, No Time to Teach, which is the source of so many of our episodes. And Fran, today we're going to take a topic out of the book and something that you talk about a lot, and that is patient education must be a conversation. And what we're going to talk about is teaching in a two-way conversation. And so first I want to ask the question, why should patient education be a two-way conversation?
Well, there are lots of reasons, mostly because it doesn't work if you don't.
Yeah.
Uh, the key is really to involve the patient in the process and to individualize teaching to the needs of the learner. And if you don't have a two-way conversation, you're teaching at them. So you have no opportunity to involve them or individualize it. When you have a conversation, you can listen to what they're saying, you can respond to it, and you can modify what you say to match so that the conversation really makes the teaching more efficient.
Yeah, and historically, you've actually talked about this in other episodes, some of the early ones where the old school way was the doctor or the nurse telling the patient, this is what you have to do. And, you know, in the old days, that's what the patient did without question. And today, not so much. It doesn't happen that way as often. We've also talked about the key to patient education is drilling down to the core of the issues for the patient to make sure that they actually do understand. Because so often, if you give them, okay, here's 3 things you got to do you understand? They're going to say yes. And then they go out and they have no idea what you talked about. And the other thing that we see happening, and you talked about this a little bit at HCA, is there is a huge industry trend right now to create a whole bunch of apps. And there is a tendency that we're beginning to see where people are recognizing that patient education is a problem, but they're creating apps to take care of it. Now, I don't know about you, but I don't have many conversations with my apps, you know?
Exactly.
So, you know, this looks like it's counterintuitive to what perhaps needs to happen. So weigh in on that.
Well, I think they're confused about the difference between information and patient education.
Mm-hmm.
Patient education is a process. It's actually teaching. It's actually assessing and evaluating understanding and moving the patient's understanding along. If you've just got information in an app, then that's only information. You don't know whether it's understood or processed or applied. So it's not really helpful. I mean, there's some apps that actually inspire conversations by giving cues for conversations. And that's great because that's the thing that actually makes patient education happen.
Mm-hmm. Yeah, that makes a lot of sense. Now, do you recall when you were at HCEA, you gave a keynote and you did a fair amount of new research before going and while you were there. And a couple of things struck you about the best way to do education during while in the hospital stay, and then what to do after the hospital stay. Do you remember what your conclusions were?
Yeah, in the hospital, you really have a great opportunity to have conversations because you're always walking in and out of the patient's room. The patient has questions during the process. So you have lots of opportunities, even if they're short conversations, to teach, to do patient education, to actually assess and teach and evaluate understanding. So you don't need a lot of stuff. You don't need apps in the hospital. Videos are great because they can demonstrate and illustrate stuff that some people need to see in order to learn. Mm-hmm. They're not necessarily good at learning stuff by just hearing it. So videos and handouts are good because they can take them home and refer back to them later, or they can take notes on them. Mm-hmm. So those are still very relevant in the hospital. Now you can refer patients to apps and websites and other resources to deal with when they go home, because the learning never stops. The information, there's just so much they can absorb in the hospital, but if it's a chronic illness or something that's going to take a while for them to recover from, they're going to continue to need more information over time. So those resources are good for referring to later. And then when you have follow-up appointments, you can ask how that was going and whether it was helpful, and if they got any questions based on what they read or used in the apps.
Yeah, and a couple of key things there. A lot of times the information you get from the doctor or the hospital is something that's been copied and faxed a million times. It doesn't look, I could show you some examples of things I've gotten, and it's like, you want me to read this? It's not helpful. And it would be really helpful to get a list of information along with some to-dos, along with some frequently asked questions in any type of handout that you get from the doctor. And I don't mind if they prepare them. And matter of fact, I kind of prefer that. But let's keep them up to date. With all the word processing power that we have today, let's keep those up to date. And also make them so that you could email them to me as well, so that I could have them electronically. Because there are going to be people like me who prefer to use things electronically, because I use things like Evernote and I have Google Mail and all this kind of stuff. So I keep everything. But there are going to be others like my wife who she's not particularly interested in her phone except to talk on it. And she's not going to collect a lot of information, so she wants paper. But it needs to be paper that she's going to want to read. And she will go do research. But she's got to have good sources. And so that kind of stuff is invaluable. But the step that's always missing, you touched on it just briefly there, is when you make the follow-up. In 2 weeks where you could ask questions. Well, a lot of times you don't go back to the hospital for the follow-up. You go to your family doctor or whatever. So you don't see the hospitalist or anybody else in the hospital for a while. So a phone call to me within a week that would be relaxed and give the patient some time to think of questions and, underline stuff for those that'll do that. That to me would be really valuable, because that's when you start seeing things that you don't get, or questions pop in your mind. It's like, gosh, I wish I would have asked this. So to me, the conversation needs to extend. I think an app is fine. I think handouts are fine. But without the ability to come back and ask questions for follow-up, it's not enough. You know what I'm saying?
Oh yeah, and research is showing that those follow-up calls are worth every penny to the hospital, because it does keep people out of the emergency room again for the same problem, because sometimes they don't understand, and it really does help to nip it in the bud.
Yeah, and it's just I don't know. It's one of those things where without the ability to go back and forth and for the patient educator or the doctor to really drill down to what's in the patient's head at the time, and that will change. You never really know what they're thinking, and you can't ask that question, do you understand? Are you with me on this? And it's like, no, you can't do that. You got to, use your old standards, assessment and teach back to figure out, do they really get it? And there may be some other issues that are beyond just comprehension of things that they just physically can't do at home.
Yeah.
So,
I mean, we find at my hospital there are a number of patients who live out in the countryside,
mm-hmm.
and they don't have running water. I mean,
Yeah.
We make assumptions about a lot of things.
Sure. Yeah. And it's you think in this day and time where every quote, everybody has cell phones and everybody's cares about what the Kardashians are doing at because if you watch the news, they say everybody's doing this. Well, it's not true. It's a very tiny percentage of people that are doing those things. And so there's still a lot of people that their lives haven't changed in a long time back from, I don't know. Well, you know what I'm saying. So if we can kind of summarize this, you've always said that there is a need for two-way conversation. There is going to be more and more apps created for doctors to give to patients. Say, download this app and it'll tell you everything you need to know. And basically what that does is it moves the responsibility for education away from the doctor to the patient, which is fine as long as the patient's comfortable with that. Am I on target
Yeah,
with that?
I think the term that people keep using now is patient empowerment.
Mm-hmm.
And what they really need is collaboration.
Yeah, there
Not
you
so
go.
much that the patients are responsible for all their own care, but that everybody works together toward the same goal.
Yeah.
That would be a much better way to deal with it. And by having these conversations, we can find out what the shared goals are and how to get there.
Yeah, yeah, and as you've said so often, and the basis of the book, No Time to Teach, is you do have time to teach, and if you take these few little opportunities along the way and maximize those, you won't have as many readmissions, you won't have as many problems down the road because things are resolved properly.
Exactly.
Okay, excellent. Fun topic. My guess is we'll talk about this some more.
Yeah, it'll come up over and over again
Yeah.
until everybody's doing it.
Yeah, absolutely. Yeah. Okay. Well, great. Why don't you tell folks how they can reach you online?
Well, I've got a blog at notimetoteach.com, and I'm on Twitter at notimetoteach.
Okay. And you're also on Facebook and Google Plus. I see you out there all the time. And for those that are interested in Fran's book, No Time to Teach, it is available at Amazon and other book e-tailers and retailers. It's available in both paperback and downloadable form for your Kindle or e-reader. And if you want to use it as a in-service teaching resource for groups, you can get a significant discount by visiting her publisher, Pritchett and Hull, and their website is p-h.com, and they will give you a sizable discount for a bulk purchase. And for those of you that want to have a big impact on patient education by providing your in-hospital patients with video on demand, I would encourage you to visit our website, synergybroadcast.com, and look up our patient education system, MMDS, or medical media delivery system. It's a great, inexpensive way to provide 24/7 video on demand access to both patients and staff. So Fran, great topic today. I suspect we'll talk about it a few more times over the next few months. And maybe we'll even get into some of the apps and how best to use them. So I think we can have some fun with it.
Yeah, it's a great topic.
Okay, so thanks so much. I'll talk to you next time.
Okay, bye, Chuck.
Bye-bye.